Just educate yourself.
They were at the office all the time.
That case was stressing me out. You couldn't find a worse thing to do to a patient. If you're losing some teeth or you lost all your teeth and you're looking at options such as all-on-4, 3-on-6, or even snap-on dentures, I have a special video for you. In this video, we're gonna go over the pros and cons of all our options, but also more importantly, I'm gonna give you perspectives from different types of specialists and their experience in placing dental implants. So stay tuned. All right, everybody, so let's introduce ourselves. My name is Dr. Daniel Choi. I'm a board certified periodontist of 13 years. Placed my first implant back in 2009. Placed many different dental implants for many different applications, whether they're for single dental implants, implant bridges, snap-on dentures, all-on-4s. So placed probably between 10 to 15,000 implants in my career. So Dr. Nguyen.
I'm Dr. Monvu Nguyen. I'm a general dentist for over 13. Placing the same as Dr. Choi, but not as advanced. I've been placing implants for over 8-9 years.
Dr. Koo.
Hi, I'm Dr. Tyson Koo. This is my 7th year in private practice. I've worked in various settings, but I've been drawn to the surgical side of things for quite some time. And after placing over 1,000 implants for individual teeth, snap-on dentures, and all-on-4 fixed teeth, I joined North Texas Dental Surgery last year.
Thank you. And Dr. Kukusaki.
Hi, I'm Dr. Ioana Kukusaki. I am a prosthodontist, a specialized dentist. I graduated from the dental school in Greece, and then I pursued a 3-year advanced training program in prosthodontics here in Texas A&M in Dallas. So these 3 extra years of training gave me the opportunity to be able to treat patients with complex mouths, and also being able to restore like cosmetic cases, aesthetic cases, and all types of full mouth rehabilitations, including crowns, veneers, all-on-X, and dentures and snap-on dentures.
Okay, so let's talk about a very important topic. You know, I've seen it in questions that we've had from patients over the years, and even my perspective has changed a lot about this. It's basically all-on-4 versus snap-on dentures. Did my first cases back in like 2009. You know, something similar to an all-on-4, just wasn't happening all in one day, but also did my first snap-on denture back in 2009. I could tell you personally, my perspectives have changed significantly over the years. In regards to kind of like, you know, patient experiences, you know, meeting their expectations, the whole process and everything. So I want to go to you, Dr. Koo, first in regards to kind of your perspective. I know that you used to work at a, like a snap-on denture, and actually an all-on-4 center also before you joined us. But I'd like to hear your perspective in regards to what patients' expectations and them being met. If you could tell me like what your perspectives were when you were talking to those patients.
Sure. So at both places, patient came to the offices, you know, with the expectation that they will get something that's gonna feel and function just like their natural teeth.
Like I tell patients like they're 18, right?
Correct.
Yeah, like 18 years again.
Yes. So for both type of, you know, set of teeth, I can make sure that, you know, the patients are happy with the aesthetics. But in terms of the function, it's night and day difference.
Right.
Yes. So
could you like expand on that though?
For sure. So people that I saw at the Snap-on Denture Center, they were at the office all the time due to things breaking or things having to be replaced quite frequently. So with the Snap-on dentures, I would say there are the female part and male part inside of the denture.
Right, the part that snaps
Correct.
and clicks in, right?
Yes, yeah. And depending on how the implants are placed, those parts may have to be replaced quite frequently. When we do snap-on dentures, we want to make sure the implants are placed in a parallel fashion.
Right. The issues is that, you know, we can try to place them as parallel as possible, but we are within the functions or the limitations of the patient's bone, yes. Right? Sometimes it's shaped like this, sometimes they have extreme bone loss. It's not all the time where we have that ideal bone where we can place the implants as parallel as possible. So even if we try to do as perfect as a job as possible, and I'll even make my arguments again, oh, you can get perfectly placed implants with guided surgery, you know, not, you know, I definitely don't agree with that, but, you know, and that's a conversation for another day, but I have similarly, over all these years, have found it, you know, that through my personal experiences, trying to meet expectations is a key thing, right? So being the owner of North Texas Dental Surgery and basically, you know, caring a lot about my patient's customer service experience, it was always very important that, hey, that we deliver on the promise. So my like philosophy has always been under promise, over deliver. How do we meet these expectations? But, you know, I think that if we have a patient that is thinking that they want to get a set of teeth and it's like they're going to feel like they're 18 years old all over again. I feel like it's very, very difficult to manage those expectations with the snap-on denture, right? And so key thing being also, how do you manage expectations? What does that even mean? I think that even if you had a patient like who is patient throughout the process and then they get their final set of teeth, you know, for them to be elated and not have to have any issues and have them keep coming in, right? But what I would see through my personal experience, you know, and then I want you also to share with me, Dr. Nguyen, too, like, because I'm sure you're probably going to say something similar. I would have cases where I swear I would place those 4 implants as parallel as possible. I had the bone on this patient that was ideal as possible. The guy just had a thick biotype, thick bone, thick gums, and we have a very ideal case. And then there would still be issues even after the fact where they would be coming back like once a week for like 5-6 weeks in a row where this bothers them now this bothers them, now this bothers them, because one of the issues with the snap-on denture is that it is also not only snapping into your dental implants, but it's also resting on your tissues too, right? And so meeting those expectations, right? And just like, what are your thoughts, Dr. Nguyen?
I mean, my first snap-on denture I did was actually on my father back in 2010, and the reason why we did it on him is because he had no bone, right? So when you have no bone, a regular traditional denture just doesn't work.
Right.
So it was presented to him at the time at the faculty by the periodontist actually at the school, and it worked wonders. But the same thing with what Dr. Koo was saying, does it replace natural teeth? The answer is no. Now, what I tell my snap-on denture patients or even my normal denture patients, there's a huge adjustment period, learning how to use a prosthetic part that you haven't had any time to get used to. When you're incorporating something in and you're trying to meet the expectation that it's going to replace permanent teeth, the expectation of that is going to be pretty severe, pretty severe. So with an all-in-4 or all-in-X or whatever we do here, that's probably the best step to getting you something that's natural in function as well.
Closest thing towards having your natural teeth. Yeah. And I tell patients this all the time. Nothing is as good as having your natural teeth, right? The functionality and just everything about it. Now, again, what state you may be in, you know, are you 40, are you 50 years old, are you 60 years old, have you lost all the teeth, do you have periodontal disease, are your teeth been moving on you, are you not happy with the aesthetics? Obviously, there's many different factors that come into play. But if we can go back and rewind the clock, and if we were 18 all over again, nothing's ever going to beat that set of teeth, right? But I agree, just managing expectations is very difficult. And again, that's even with a very, very, very ideal case. And then quick question before I go to Dr. Kukusaki, but you mentioned about like comparisons versus like regular dentures. Could you expand on that in regards to like the snap-on denture versus even a regular denture?
So what I've seen with regular dentures, what we're looking at is the length of the ridge, the width of the ridge, and how much extension, of how thick and how long your dentures can be to grab every single part of your mouth for it to stay, right? That gives it what we call retention, like a suction cup effect.
Right.
And when you don't have that, the next step is to have implants that will help support to give an additional retention for that, and that allows it to what you hear with those snap-on dentures is the little clicking effect.
Right.
But over time, that clicking is because it's nylon or whatever the material may be, it just wears out.
Right, the nylon is underneath.
Yeah, and that's what Dr. Koo has mentioned. It's you have these frequent visits of patients coming in, and at some point these patients are like, well, then I should have just done the all-in-X if I was going to be seeing this frequently, and there's more maintenance to it.
And how many patients have we seen that have had snap-on dentures that years later they're like, you know what, I've saved up, we're going to the all-on-X, all-on-4, all-on-6.
And it's the same thing, it's a denture made of acrylic, so they wear out faster than a zirconia all-on-X or all-on-4.
Right. And then I also wanted to expand on another thing real quick. Now, we know that we can use different teeth options, which are more expensive for your denture, that are more aesthetic. But if you get a traditional like snap-on denture that you will get at most offices, the aesthetics, and if it's acrylic teeth, how do those hold up aesthetically over time? But Dr. Kukusaki, all right, so you as a prosthodontist, what are your thoughts in regards to like managing expectations, meeting expectations, what you've seen, how happy patients are from a snap-on denture versus all-on-4?
Yeah, something that we need to point out is that all the all-on-X prostheses are going to be staying in the mouth, so they are fixed. All the other options like the snap-on dentures and even dentures, they have to take it out at night, they have to clean it, they have to put it into water, actually maintain it as well as possible, but they're actually not going to have the teeth for the whole day, like the 24 hours. So another thing is that because it's tissue supported and implant retained, as you said, a snap-on denture, yeah, that means that we have like to capture more of these anatomical features that everybody and every patient and every mouth has. So that means that it's going to be more bulky than an actual on and X prosthesis.
Right. So if like, not to interrupt you there, but this is clearly just look at the difference in bulk.
Yes.
I have an interesting story. This happened back in the day when I was contracting part-time at some other offices. There was an office in Fort Worth where I was contracting on, and I did 4 dental implants for a lower prosthesis. And so I was just doing the surgeries there, and then the general dentist over there was doing the prosthesis. And so, you know, there was an issue that this patient, the implants were fine, and the last time I saw the patient, and this is months after the surgery, her implants were fine, but then she was had a prosthesis that she was just complaining that it kept on coming off. And I was like, okay, like in my head before I saw the patient, my thought was like, okay, if it's coming off, did something happen where the implants were potentially misplaced, the angulation wasn't great, all these things. But I looked at the x-rays, they were fine. What was actually happening is the dentist that had restored the case didn't put any flanges, these extensions for this denture, because they were trying to minimize the bulk and almost make it function. The lab had actually sent it back like that. What had almost made it function as if it was like an all-on-X type of prosthesis. And you can't do that, clearly. You know, what patients need to understand is that when they're chewing, right, it's an envelope of motion where it's like this, not like those little toy models are like clacking up and down. So whenever you have an envelope of motion where there's also horizontal forces and you're chewing like this, if this snap-on denture doesn't have those extensions on it, it's just easily going to dislodge, right? Again, because those are just snap-on nylon inserts that are keeping into place versus something that's screwed in. But yeah, sorry to interrupt that, but
that's a very good point. And plus, of course, that snap-on denture would have acrylic teeth. And compared to zirconia, the material is totally different. Zirconia is much stronger. Also, it doesn't wear, but dentures and all the snap-on dentures do wear really, really fast. And especially we have an opposing dentition that's actually natural teeth. In this case, they have to come in again and retooth like the denture or even rebase, because over time, the bone is gonna recede more, the tissue is gonna change. So either way, they have to change like approximately every 6 years so that they can actually have a fitted snap-on denture. And that's totally different with an all-on-X, that they can actually have it for the rest of their lives. Of course, they have to like maintain it and have the mouth guard and of course like keep it clean. But it's a totally different aesthetic also consideration. About that material.
But so you would say that, but in regards to meeting expectations, all on X, all on 4 is going to be like much better able to manage expectations than a snap-on denture, right? Making them feel like they have their youth back and the confidence, and not like, and then, okay, so managing expectations. And again, we discussed this earlier, managing expectations also involved like, you know, for me, like to tell you a little bit of a personal story, I am way too busy to deal with problems. When I had my house built like 8 years ago, I remember they were asking me what kind of plants I wanted planted, and I was like, whatever needs the least amount of water or maintenance, like, because I just don't have time for anything. And so everybody's got busy lives. What are your guys' thoughts in regards to what do you see after a all-on-4 or a snap-on denture that seems to cause more issues or aggravation for patients?
Well, what I've seen with like snap-on dentures is the patients want to wear it all day.
Okay.
Right. So what happens is now the tissue is irritated.
Okay.
And especially at night, people become self-conscious about it. So then they wear it all night and they come back into the clinic and their gums are all inflamed because the tissue hasn't had time to heal and the denture hasn't been cleaned.
Okay.
So that's one of the big issues I've seen with snap-on dentures is cleansability-wise and the amount of coverage it has with patients just being self-conscious about it.
I've actually seen that, and I totally understand that and empathize with it. I've had patients, it's a female, and she's like, hey, could you please, before we sedate them, they're like, could you please make sure that before I leave, we put the denture back in my mouth, because my husband hasn't seen me like this, since 30, 40 years ago, or not even ever since they met. So what about in regards to like, if you expand a little bit about the nylon inserts and like all that type of stuff?
Yeah, it's clean underneath the surface. Make sure they're nice and clean, because if there's any debris on those inserts or even around your implants, right, the snap-on effect won't be there. So you do want to make sure you get a nice toothbrush and cleaning it like you are outside of the mouth. One of the big benefits people say is with the snap-on denture is you're able to take it out, clean it, and snap it back on so it's nice and clean. But once they lose their retention, you're seeing that come off more often, more food's getting stuck underneath. Like Dr. Kukusaki is saying, they have to rebase every 6 years or so. But by then, the acrylic teeth have already worn down.
And one of the frustrating parts of that is that they said, well, I already spent this amount of money. What the heck? Like, why am I having to get another denture all over again? And then average cost, if it's like $2,500, $3,000, that's another big investment that comes later on down the road. And we don't see that with zirconia, but with all-on-4. But let's also expand a little bit. Like, what are your thoughts about like nylon inserts? Because one thing that pops into my head.
I actually show this to the audience. So whoever's doing the work for you, like let's say you decide to get the snap-on dentures. Whoever's providing the work, in my opinion, that provider should give you the least retentive nylon parts in the beginning.
So there's different types of strength of inserts, right?
Yes.
There's some that are very flexible and spongy. And so when you're putting the denture on or off, like the reason why they're actually like that, we know this. If your implants are not perfectly parallel, which we know is not feasible all the time, right? So what ends up happening is that we have like these nylon inserts that are more flexible that can compensate for like your implants being divergent and not perfectly parallel or convergent, whatever. When you have cases like that and they are looser inserts, that means it'll go on easier, but the problem is they'll pop off easier. And then if the other thing I've also seen is like if they're too tight or too rigid, we have patients that like can't even get them off, so they get upset because they're like, I like literally have to put like the back end of a hammer to like lift this thing off, right? And it sounds like a ridiculous example, but what were your thoughts about that again, Dave?
So may I have a controversial take a little bit?
Go ahead.
So
this is what this is all for. We'd love to hear it.
Well, people never want to downgrade their lifestyle, right? So if they're used to a certain like lifestyle, for example, you don't want to go down. You only want to go up, right? What's going to happen to these inserts are that they're going to wear out over time. If we start you out with tight retentive inserts, then over time you're going to want more retention instead of less retention, right? So that's why we sometimes get patients that get these initially and several years later they want the all-on-4 teeth. Yeah.
That's an interesting take. All right. Yeah, that's like, I mean, that's all part about the managing expectations, right? I mean, truth be told, it's like trying to manage expectations with an inferior product. Again, like we can only do things as well as you can. And this is like what I was talking about earlier on. It's so frustrating being that person. You're sweating placing those implants, making sure they're perfect, and you're trying to get that prosthesis to be as perfect as possible. And like, voila, perfect. I'm so happy for you. Boom. They call you a week later and they're like, hey, I need to come in. This thing is just not right. Make a modification. This thing is not right. And it just keeps happening week after week after week after week. It just is annoying for the patient, and it's frustrating for us because we want to have a happy patient in the end. They invested a sum of money, and like having happy patients in the end is like why we're all doing this. And it's I feel like functioning with one hand tied behind my back with this product, right? So and again, like my thoughts were not always like that. When I was in residency and like first years of practice, I was pushing, when patients were asking me, what do you think? And I was like, snap-on denture all the way. Why not? Like you spend less money, right? Well, sometimes, because if you do excessive bone grafting, sinus lifting, all these things, then you're paying just like almost like a comparable amount to an all-on-4, right? What I've seen from patients' reaction, and then patients who have had a snap-on denture and all-on-4 in the same mouth due to financial reasons, and what they tell you, right? And then patients who have had snap-on dentures and go to an all-on-4, and they tell you how different their lifestyle is now, right? Like, and what they can actually chew. Hearing those like many different perspectives has really changed my opinion in regards to like the options that we present. Now legally we have to present all their options, right? But I like when they ask me for my honest opinion now from everything I know, I'm like, dude, you gotta do all-on-4, right? So Dr. Kukusaki, what are your thoughts?
Yeah, I would totally agree with this. Plus, because the implants for a snap-on denture, they're basically in the anterior area, so we get sore spots in the back, and the patients have to come again and again to, relieve these areas and make sure everything is fine. But they're gonna come again because at some point another spot on the tissue is gonna be, bothering them. So I've been taught that you actually marry the patient that's gonna get a denture or a snap-on denture, and at the end of the day, the patient is gonna be like, after 3 years of struggling with these or like trying to get these working, and they're gonna come back and they're gonna say, okay, can we add 2 more implants at the back? But at that point, everything has already changed because the bone has now recessed so much in the back, like you don't have the space in the bone with the extra implants, but the patients wanna go to an all-on-X.
The bone, like the tissue quality might not even be great from the get-go. Maybe they had a thin biotype. It just makes the surgery, long story, harder.
And then, it's the same thing with when you're doing a snap-on denture, patients think 2 is enough. 2 is rarely enough, right? Because I always do the analogy of like a tripod effect, at least with a chair or 4. 4 is ideal, and tripod's the next step down, and 2, I mean, it'll give you something, but it isn't what you need. And honestly, with a snap-on denture, the only time it really works is when it's opposing another denture. Because if you're opposing a natural teeth or you're opposing an all-on-4, I mean, it's the strength of that opposing or that opposite tooth that you're hitting against, it's going to cause it to rock either more or less.
Right. So actually, this model is a 2 implant, overdenture for a lower. And that's another thing, by the way, is if anyone ever tells you that a 2 implant upper overdenture is going to work, it's not. I've seen so many cases where those failed, and that's something I learned in residency, and I was shocked. There was a guy I was contacting in an office. This happened in my first or second year out from residency, and he wanted me to do a 2 implant upper overdenture. I was like, it's not going to work, and I didn't do it. But after the fact, I've seen many cases come into the office where they had 2 implant upper overdentures, they didn't work out. So if it's gonna work, it's gonna work on the lower. And also, like, even in this model, you can't hear it, but it's creaking. When you're chewing on this thing, it's gonna drive you nuts.
Yeah, the tissue is compressible.
Right.
In the front, because they have the implants, it's not compressible, but in the back it is. So it's gonna...
Right, it's gonna rock, it's gonna hit your gums, it's gonna hurt your gums, it's not retentive in the back, and it's just frustrating in that aspect. So one other thing that I tell patients in regards to like managing expectations, listen, if you've been in dentures for years and you're just, sick of using so much adhesive and it's just been really frustrating and you want a little bit of an upgrade, then yeah, snap-on dentures can work. Now, if you got the finances, because the elephant in the room is always gonna be finances, right? If you can afford it and you can swing it and make it happen, then do the all-on-4, right? The other thing too that I really want patients to understand, this is a key point, right? Patients I get it. If I was in their shoes and you see like a financial difference, patients are going to sit there and say, oh, you're trying to sell me on something because that's more expensive. Like, listen, in the end, we just want you to be happy. A happy patient is going to refer more friends and family. A happy patient isn't going to be coming back every week for the next 6 weeks and coming back every 3 months for nylon inserts that need to be changed. And then the other aspect, running this business, when patients want to know truly if it was a really financial decision, as if we were trying to sell you on that, it's not. What do I mean by that? Is like every time you come into the office or you're coming in here and like we have to see you, I mean, that costs us money too, because we have staff and all these things. And when you truly do crunch the numbers, when you look at the financial difference between offering snap-on denture services for an all-on versus an all-on-4, because there's so many other things. For example, like when we built out our lab, that was like another $200,000, and having a zirconia mill and having all the essential team members that we need to kind of go through all the process to make sure that we can do the all-on-4 process. In the end, I feel like financials are about the same, right? So the all-on-4 is just priced out more because there's more overhead for us to carry. For me, in the end, I just want a patient that is happy, and a happy patient, again, is gonna refer more friends and family. And the other thing too is like, what would I want? I don't have time in my life. If I need to go to an eye appointment, I need to go find a place that's like open on Saturdays, because I literally have no time my schedule. Do I have time to go to a dental office where after I've been patient throughout this whole process to get my final prosthesis, there's still things that are bothering me and I need to go back for another appointment weekly for another 6 weeks and then keep coming in every 3 months? I don't have that time. But did you guys have anything else to share in regards to, and I do want to say one thing in regards to this. I don't want to sound like I'm crapping all over snap-on dentures. Again, if you are a patient that's already in regular dentures, or you don't have teeth, or you just need a better option, at that price point, it can be a favorable option for you. But all things considered, understanding the financial aspect of things and how it's always the elephant in the room. But if you can swing it, then, look at something like a fixed option like all-on-4, or, potentially even implant bridges that are all splinted together. Hopefully that can answer a lot of the prospective patients' questions out there in regards to like the main differences between those two and like kind of like our insights on it. Now, I get a lot of questions about this lately online, and we've even had a patient come in, had done extensive research online, and he was wondering about the differences between all-on-4 versus fixed implant bridges, and I'm gonna just call it 3-on-6 implant options, such as 3-on-6, because I know a lot of people have been talking about that recently. So all-on-4, yes, great product. But
plus the phonetics, the speech adjustment is much easier, and it's gonna be in a less time than having like a bulky denture, snap-on denture thing.
Right.
It is like natural teeth. It's like replacing their teeth. So they're not gonna have an extra bulky thing to make sure that their tongue can go find the areas and speak normally.
However, there's a big caveat to that. Okay, so placement of the implants along with multi-unit abutment selection, correct?
Mm-hmm.
Because
that's true.
The multi-unit abutment selection, if we don't pick the proper ones, it can increase more bulk on the tongue side, which could affect your speech.
Right.
The phonetics, the speech, balancing that along with the functioning where the teeth are supposed to be, the actual chewing aspect of it, and just there's so many things that you guys are balancing that I feel like a lot of people kind of take for granted. But when you have a patient that's lost all their teeth now, and you're trying to find that proper jaw relationship and trying to find that perfect, let's talk about, obviously the elephant in the room also is gonna be aesthetics, right? So I give all the credit to you guys, and Dr. Ibrahim, also our other prosthodontist who's not able to join us today, but what you guys are able to do for our patients in regards to balancing all those, because it's not easy, right? But just touching upon the phonetics aspect of it, your phonetics can be drastically impacted by improper multi-unit abutment selection. But the beauty of this option of all-on-4 is we at least have the option of multi-unit abutments versus you're a lot more limited with the snap-on denture, right? What are your guys' thoughts in regards to this topic? Do you guys have any thoughts?
Speech is going to be the big thing, because like I said, I've done a denture on my dad. Going back to the snap-on denture, right? You have this roof of the mouth that is covered, and people take for granted what that does to your speech and to your taste. If people can overcome that, they adapt to it, because the tongue, after a certain amount of time, does adapt to it. So, but will it be the same? The answer is no. Right. So when you get something that's nice and thin, and once we were able to dial things in and make them as smooth as possible, the patient feels like they're back to normal.
All right, so let's kind of come back to that point we were talking about earlier. So I've done some research on 3-on-6. I'm not trying to attack it by any means, right? But the funny thing is that all-on-4 wasn't it started by Nobel, right? The terminology? Yeah, Dr. Palomalo invented the concept, but I believe Nobel, the implant company, could just, it's kind of like Kleenex, right? It's a tissue, but we call it Kleenex a lot of times. Or back in the day, Sony kind of became synonymous with a lot of TVs and stuff like that. But 3-on-6 now seems to be synonymous with individual implant bridges, right? So what are your guys' thoughts in regards to, because I have mine and I'll share those in a second, but let's talk about all-on-4 versus 3-on-6. What are your thoughts in regards to, offering, because again, managing expectations, predictability, and also long-term result? What are your guys' thoughts? Let me get your thoughts on that.
Yeah, there are 3 individual and separate bridges, and they can be either on 6 or we can also place more 8 implants and have some single teeth as well. So the whole, the advantages is, first of all, that they have only teeth replaced, no gum replaced, so they can actually show their natural gum. The other advantage is that in case they break something, they will just have to replace that specific bridge that contained that tooth that broke. So they don't have to repay for the whole thing, and they don't want to go to the whole process of just getting a new prosthesis, because if they break an hollow neck, they need to have a replacement of the full set of teeth and gums.
So you're talking about that from a dentist standpoint, though, yes. Right? So a patient won't care. So if we're doing a 3-on-6 versus all-on-4.
And the other thing is that that if they have a lot of teeth that they're actually have missing for a long time, they're gonna also have a lot of space in the mouth. In this case, they can do 3-on-6, because in this case they will have to replace also gums and also the tissue that has been recessed and is missing for all these years. Another thing to consider when we're gonna have to see which option we're gonna go for.
Okay, so this can get really technical, so we don't want to confuse the people out there. So let's take a step back. Let me ask you a quick question. If you were to, your grandmother, half her teeth missing, and now, a prosthodontist, you have the financial resources, you tell your grandmother over in Greece, hey, fly over, and we're gonna take care of you. Without looking at her, what do you think the most predictable option is gonna be for her? Is it gonna be an all-on-4 or a 3-on-6?
All-on-4.
Okay.
For my
so
grandma.
For predictability.
Yeah.
For the surgery, and also let's talk about, I don't know how old your grandmother is. How old is your grandma?
About 80.
80, okay. So you wouldn't want her to be in a situation where 5 years, 7 years from now, if she slows down a little bit more, I'm sure your grandmother's in great shape, but if she's slowing down a little bit more, that she then starts having more dental implant issues, and now she needs to come into a dental office with kind of decreased health and like putting more stress on a person. Let's talk about that perspective. What do you think can give you more predictability over the long haul to not give your grandmother issues? In individual implant bridges, like a 3-on-6, or all-on-4?
All-on-4. First
Okay.
of all, yeah, the treatment is gonna be, it's not gonna last long, because 3-on-6, you have to take care of bone recession, and you have to take care of a lot of bone grafts that you have to do, tissue grafts and stuff. All-on-X is gonna be much more straightforward and a very shorter period of time that she has to heal and take the final teeth.
Okay, so you're saying the surgical process, even before the path, basically, before you get to your final product, you're saying that from day one where they come in for their initial consultation or their exam to the day that they get their final set of teeth, that they're all screwed in and good to go, fly back to Greece, that period of time is a lot shorter with all-on-4, correct? Right, we know that, right? Fortunately, the staff, I mean, like a lot of people, the folks out there don't know that. But the other thing...
Plus is the hygiene.
Okay. But the other thing is that process, that's a complicated process, right? It is. If we were to provide that, I mean, and we do provide that option. We try to steer the patients away from that option, right? But it is a lengthy process. I met a patient who, I think they're from like a few hours away, 3-4 hours away here, but they're still in Texas. But the husband had 3-on-6 done. And he said it took him 2 years to get finished, and there was all these things that happened versus his wife's all-on-4 process. Like, so completely different journeys. Now, we will have conversations about it later on in the day. Sometimes things can happen with all-on-4 also that can lengthen the process too. The whole objective of this conversation is to let people know that every option that we choose can have a pathway that can be longer than expected, right? There's things that can happen 100% before we can get you that final final product. But if we were to make a blanket generalized statement in regards to what pathway could get you the most predictable response the fast, then we'd all agree that it was all-on-4, right? But it's not always about fast. Like for me, I actually don't care how long it's gonna take as long as it's done right. Because again, I don't have time to like mess around with things. So if you give me an option that's gonna be the most predictable option, 100%, then with me being the guy that's doing the surgeries and all this stuff, then I'm gonna say all-on-4 all the way. What are your, I want to hear your guys' opinions in regards to this exact same
Well, the same thing with the doing the surgery part, right? I think there's less room for error for an all-on-6. For 3-on-6. 3-on-6, because the teeth literally have to come out perfect. And when they don't, what are you doing? You're gonna have to graft, sock, and you're gonna have to wait for that bone to regenerate and heal up, and then go back into it again at a later point in time for it to be even a success on that point.
Right. So we will make videos in the future talking specifically about that, but we know for a fact that when you're doing individual implants, you have to, we're doing immediate dental implants. When you said that there's basically less room for error on a 3-on-6 or implant bridges, we have to, especially the anterior implants, they have to be placed more palatally. We have to make sure that we have good buccal bone, right? We have to make sure that maybe we have to graft that. And then here's the kicker on top of that. Are we gonna have the certain amount of torque that is necessary to load those implants immediately? And so the problem with the 3-on-6 or implant bridge option, so you gotta at least do 8 in my opinion, is that would you place those implant bridges, like the prosthetics, so temporizing and managing expectations? If I was to tell a patient that we are going to do, let's say we're not going to do, like, in my opinion, 6 implants isn't enough up top. We're going 8, okay? So we're doing 8 implants. We're doing implants every 3 teeth. So we have a fake tooth in between. Now, again, if we're doing like every 4 teeth on the back, in my opinion, I mean, that's definitely not good enough, especially if we're doing immediate implants. Are we gonna generate enough torque, especially on cases where patients have low sinuses? I mean, most people have low sinuses back there in that area, right? So do they need sinus lifting also? Do they generate enough torque? And then, because there's not any bone reduction or very minimal, we now are going to temporize those teeth with, you know, whatever material, and it's going to span 4 teeth. We had conversations about this earlier, right? There's that prosthesis, or the teeth would be breaking like crazy during those like 4 or 5 months of healing. And you said you saw that, right?
Yes.
Yeah, you've seen that multiple times. And so if I was to create a option for a patient, or a solution for a patient that would drive my patients crazy and make me again pull my hair out over the next like few months because they're constantly upset because they're coming in all the time. It even happens with all-on-4 sometimes, right? The prosthesis can fracture. We want to again manage expectations. That prosthesis can fracture when you're in that temporary state, but that thing's a way thicker versus like a 3-on-6 or implant bridge option, temporary prosthesis. Number 1, did we place those implants palatally, especially in the anterior, so we don't have any aesthetic ramifications? Did we generate enough torque to do immediate loading? And again, if we're not, then that patient's gonna have to wear a denture. Then they wear that denture for 4 or 5 months after all the implants have healed. Then we do the uncovery process. We bring them in. We have another surgery to do the uncovery process. And then also, we're probably gonna want to mold the tissues.
Shape the papillas.
Right, shape the papillas, and then, you know, create pontic sites and all this stuff to make it more natural. Otherwise, your teeth are gonna look straight up like chiclets, like just pure square teeth, and that would be unsightly. Now, most people have low smile lines, but still. And then there's other cases that are, you know, that we've also seen where patients or doctors, they'll be like, well, I'm gonna create papilla for you. And what we even have images like that you showed me that one time of a doctor who did phenomenal work, don't get me wrong, but you're kind of defying the laws of biology when you're expecting 6-7 years later for the papilla to be completely intact, giving you all these beautiful, like, I mean, the papilla and like the bridge looks, you know, fantastic, right? So you're kind of defying that law of biology. And when you do and you create those the pontic sites, and you're creating the you know, basically the lower contact points so it's not as high, so you can have your papilla, well, over time, as this, you know, your tissues retract, that just creates food traps, right? And I can just completely imagine a situation where you're eating pasta or bread and all this stuff is like getting caked on like the front of your tooth, right? And so and how subconscious you would be. And like, I remember you showed me that image. But there's a lot of nuances when it comes to 3-on-6. You know, stay tuned, guys. I will make a video where we're gonna go way in depth in regards to, again, this is not an attack on 3-on-6 or anything like that, but just the concept of implant bridges and versus like all-on-4, because I noticed that more people are talking about this. You know, one thing that I think is a very important point is understanding that there's a lot of dental offices that try to go purely all-on-4 center, that go purely snap-on denture center, that go purely, we don't mess with either of those options because we're just gonna do implant bridges. And the reality behind it is maybe it's because they don't have a lab, maybe they don't have a prosthodontist, maybe there's little nuances in regards to like their training as to why they wanna offer certain products. We offer it all here, right? So we have no skin in the game to sell you on something like a certain treatment option. Again, we just want you to be happy. Also, we tell them, patients, from our perspective, we are gonna do what we would do within our own mouth. And here's the kicker. All on, like, I mean, 3-on-6 type of prosthetics for us, or implant bridges, if you come to me and you really want that, we're gonna charge you way more money. It's way more stressful than surgery, right? Like, way more chair time, liability, long-term, right? As the owner of the practice in warranting my work, I mean, now my stress level's here, right? Because we all know placing one anterior implant to make sure that that implant stands the test of time, that doesn't have bone recession, that doesn't have soft tissue recession, that we can get the aesthetics matching right. I mean, that's hard enough on one single tooth, right? And then when we're trying to take out multiple teeth, like let's say the patient up top has 14 teeth, taking all those teeth out, preserving the interproximal bone, preserving the buccal bone, oh wow, like you stress the hell out of me now.
Yeah,
right?
that, and you're expecting the patient to heal, right? Because that's a huge factor in all this too.
Right.
It's like we can do the best job we can surgically,
Right.
but at the end of the day, we're not going home with you. We're not making sure that you're doing everything that you need to do to preserve everything that we did in the office. And that's a big play in everything that we.
You could do the best ACL knee surgery and your patient goes and plays basketball next week. As ridiculous of an analogy that is, we got patients that don't take their antibiotics after the procedure. They start eating whatever the heck they want.
They smoke.
They smoke, and it's frustrating, right? Because we're talking about, even from a predictability standpoint, the all-on-4 is way more predictable. I had a patient, she was, you remember her from 2 days ago, the one from Virginia. I mean, how many all-on-4s do we do? In that case, was stressing me out, right? Her sinuses were huge. I had to nail those 2 pterygoids. And not only were her sinuses huge, they drift very far anterior. She's 37 years old. We're not jumping to zygos immediately, right? So it's like, from a stress standpoint, like patients, like, and I've seen these on YouTube comments, like over the years, they're like, dang, you guys charge so much, and like, why do you guys charge so much? And it's just, there's so many aspects to the game in regards to, like, that affect our overhead, but also when we also warranty our work, and we're also liable for that long term. And when we treat you to make sure that you have a predictable result in the end, to make sure that you have it's got to look good too. You're not going to be happy. You're like, what the heck is going on with my gums right here, where my gums are really receded and my bone is lost? And I tell you, well, you're chewing okay, right? They don't want that answer, right? I mean, what are your thoughts?
And also, one of the most commonly asked questions for me is, Doc, is this gonna last my lifetime? Usually my answer to that is, well, with the all-on-4 teeth, we have about 25 years of data, nothing more than that, because I think it started in like the late 90s or early 2000s.
Yep.
So is this gonna last 60 years? I'm not so sure. So I usually try not to give like a definitive answer as to say, yeah, it's gonna last for a lifetime. I can't promise that.
But what you can do, though, is you can prepare that patient to make sure that they don't have any issues, and that's why we'll place more implants sometimes, right? That's why we call all-on-X. We'll place 6 implants. Like, I placed 7 implants on that patient from Virginia the other day in their upper arch. I think 5 on the lower. And there's even cases that I look at from like the 90s, or like early 2000s, with like implant bridges or individual implants that have no bone loss whatsoever. But when we do our all-on-4s or whatever implant options that you're doing, just being smart about it. And this is exactly what you're talking about, is a key point. Ability to provide a long-term prognosis when we do like a full arch of extractions, like a full upper teeth or lower teeth of extractions, and preserving all that bone. Like, why do we talk about bone all that time, right? When I go to perio conferences, when we're talking about long-term predictability of implants, that bone and soft tissue, the gums, dictates everything, right? We know that. And that's why when we're doing these surgeries, we have to be super paranoid. Palatal placement, thick buccal bone. If it's not enough bone there, and then we're like doing like ridge augmentation, GBR, doing all these things, and we're trying to preserve the interproximal bone. I mean, and the predictability aspect, God, I've extracted a scary amount of teeth in my career. Even when, again, the patient from Virginia, 37 years old. Not to sound morbid about things, but what is the average lifespan? 80 years old. So now we're talking about, I need to get something like a 43-year lifespan. This is longer than all-on-4 has been out there. But we've seen patients that have had all-on-4 for 10 years, and they have amazing results, no bone loss whatsoever. So why wouldn't it be able to last like the test of time? But the procedure has to go very well. That's why when I'm taking the teeth out, I was sweating. Right? You saw me during that surgery, and because I want a good result. I'm picturing myself in that chair, right? And the predictability on that is, from our surgical perspective, way easier for all-on-4, right? You sweat way less for all-on-4 like surgery versus implant bridges, right? And from your perspective, like if you had to bet money on us doing the surgery to set you up to do a good prosthesis, you would say that all-on-4 is going to be way easier too, right?
Way easier, yeah. I can manage the angulations of the implants, because of course implants are placed according to the bone. It's not only like the skills of the surgeons, it's where the bone is. So if the patient has resorbed bone in an area, of course we can place the implant there. So it's all-on-X is much more manageable. To look good, to feel good, to have the screw access holes where we want them, compared to a 3-on-6.
Right. The screw access holes, which are the multi-unit abutments.
Exactly.
Right. So how that comes into play. There's so many nuances that what we're trying to do in this video is let patients be aware of things that can go wrong. Now, I'd seen some photos online, and again, I'm not trying to attack anybody's work here, but I'm just looking at the prosthesis, and I'm also looking at like the surgery that they're doing, and I'm sitting there and saying, what's actually going on behind the scenes, right? So with the dental implant, unless we have a 3D scan, when we could see like where that implant positioning is, we don't know what's gonna be the long-term manifestation. We can have dental implants, as you guys know, that look phenomenal on day one, but 3 years from now, 5 years from now, 7 years from now, they can have a lot of bone loss going on, soft tissue recession, periimplantitis. Those are all factors that could have been prevented. It literally happens to the best of us. I've seen them on my cases too. But the way that we can get the most predictable response, and like, you know, what all our training was all about, making sure that you have, again, like 2 millimeters of buccal bone thickness, bone augmentation, soft tissue augmentation, get these predictable results so you don't get all that, you know, crazy recession or bone loss or periimplantitis. Now let's talk about when we're talking about implant bridges, 3-on-6 concept versus other implant bridges. And 3-on-6, or even if you do individual implant bridges, right, whether you did 3 or 4 individual implant bridges, those don't have cross-arch stabilization, right? So the concept of all-on-4, it's crazy that you can actually get away with placing 4 implants, have your whole set of teeth only on those 4 implants. All-on-4 was trying to get more credibility in, like, you know, across the United States or across the world. It was a crazy concept, right? And I remember the first time I heard it back in residency, I was like, this is stupid. I remember our implant director was in the back of the room and, like, you know, he thought it was, you know, crazy too, like as did everybody. Cross-arch stabilization is why it works, right? And so it's just a concept where basically when it's one-piece unit, this is a physics thing, which I don't remember any physics. You know, it's just literally a class I had to pass to get into dental school. But realistically, you know, cross-arch stabilization, the actual physics and engineering of it, long story short, what it does is it pulls the stress off the individual implant, right? So the implant is not overloaded. And so when we're talking about overloaded, it's not like we have a fence pole that we're just constantly shaking all the time individually by itself. But when you, like, you know, stabilize it with some, like, for example, horizontal beams, like, and you have a fence, then you pull the stress off of each individual beam, right? But when we have individual implant bridges, they're getting all that force on, you know, let's say those 2 implants, right? Or whatever area. Everybody's bite's different. Everybody got different parafunctional habits. I personally clench my teeth at night. I didn't know I did it most of my life. I've never done this, but now I clench my teeth even during surgeries, I've noticed, you know? And so it's kind of a weird thing, but I've had a lot of patients also tell me that, like throughout my whole career, that they find themselves clenching throughout the day. But because everybody's different and everyone's got different forces going on within their mouth, there can be what may work on one patient, you know, because someone's gonna say, well, I got 3-on-6, or I got the individual implant bridges in my mouth, and they're all implants, not like they have any natural teeth, and I've been fine. You're absolutely right. You could be fine, and then there's gonna be other patients that aren't. We also even had that patient, older gentleman that we were talking about a few hours ago, right? He had individual implant bridges, and I don't know how many years it's been, like 7, 8 years, whatever, but he failed, right? We literally pulled 2 implants out of his mouth. And I think he had them done at the university or another oral surgeon. I can't remember exactly what the story was. I think that one was actually done at the university like 7, 8 years ago. It's long story short, the cross-arch stabilization is a huge factor, to the point why there's now a lot of offices who will place a bunch of individual implants and call it 3-on-6, but they're actually making one-piece unit, because now they know that it's got to be one unit, what pulls the stress off of the individual implant. So I would tell patients, listen, not saying it's not going to work, but you have a higher chance of failure over the long haul of if you do individual implant bridges, whether you did 3 for a 3-on-6 or you did 4, and you break them up into individual implant bridges, you have a way higher likelihood of failing. Would you guys agree with that? Like, you know, again, it's what are you shooting for? If you're shooting for a lifelong solution, then I would definitely steer a patient away from that direction. If you got a 75-year-old patient who says, I really want individual implant bridges, and that's what I want to do, because we have some patients that are like that, we can do that for you. But we're gonna have to do one-piece unit. Well, I mean, individual implant bridges, because they don't want to do all-on-4 because of bone reduction or whatever. And let's talk about that. Then I'd say when we do your teeth, it's got to be one whole unit. You know, just like this. It can't be segmented individual implant bridges because that's going to put a lot more stress on your implants, and your implants have a higher likelihood of failing. What were your thoughts in regards to implant positioning and stuff like that? Like, let's say implant bridges 3-on-6 versus all-on-4.
Yeah, the teeth have to be in a specific position in the mouth so that they are aesthetically pleasing and they're also functional, speech-wise and also chewing-wise. For the patient.
For implant bridges?
For everything.
Okay.
So in order to achieve that, we have to make sure we have support with the implants. So if we place 6 implants and we have to split the 3 bridges, we have to make sure that all of these implants are placed at the positions that we need so that these teeth are supported.
Exact positioning.
Exact positioning.
Yeah. Way less like room for error for us.
Exactly. Right? Less room for error. And for comparing on 4 or on 6 prostheses, you can actually get that component called multi-unit and fix the positioning, the angulation, and everything of the implant so that we don't compromise the aesthetic. Because the patients need to have lip support. They have to have a beautiful smile. They have to speak normally. So I feel like if the patient is not very, very good with hygiene and have their teeth preserved, their gums preserved, their bone preserved, it's very difficult to achieve that to an older patient that doesn't have also the dexterity to go in and floss in between these 3 bridges and maintain everything we're gonna give him.
Okay. You brought up a very key important point. So when these patients come in, once we're done with the surgery and like we do the handoff to our prosthodontist, they are looking for, especially on our female patients, right? They're looking for the lip support. In a day and age where everyone wants fillers and all that stuff, make the big pouty lips and stuff. But that lip support is huge. If you take their teeth out and their lips or this sinks in, they're not happy about that. Right? So your teeth have a positioning, right? So like bodily positioning, whether it's angling your teeth or whether it's like positioning your teeth further out, that has a huge impact on how full your lips are and also the wrinkles. Yeah. Right? Because your face will sink in a little bit more. So then the wrinkles, okay, that I know I just caught your attention right there with the wrinkles, right? So I mean, in a day and age where we spend billions of dollars on wrinkle cream, this is a huge, huge component to that. Right? So when we're doing dental implants and we're placing them in your jawbone, and again, everyone who's coming in is different. This guy's got periodontal disease, had a lot of severe bone loss. This guy had trauma. He had a car accident or he lost it through a baseball accident like years ago, so he has like way less bone. This guy has relatively healthy bone, or he just has a thin biotype. All these things, I know it sounds super confusing to the people out there, right? But that affects whether we do bone grafting, all these things. And so if I'm to do implant bridges, even if it was like all splinted, then again, we have to do median implants, we have to do palatal positioning and the anteriors. All these factors come into play. And even when we do that, I can't do that easily on a patient that had trauma, that's been missing their teeth for years, on a patient that had severe periodontal disease who has bone loss, who's lost interproximal bone, like all these things. And I know it's very hard to explain to these patients on video. Can't get them what we need to get them that's gonna last over the long haul. Now, could I give you something that I place those implants, get you to be able to do your job and compromise you? Oh, heck yeah. I'm gonna totally, now you're functioning with one hand tied behind your back. And then what ends up happening is that patient starts having issues a few years later. And then that patient's really upset later on down the road because they're thinking, what the heck did I spend all my money on when I'm losing implants or I'm having these aesthetic ramifications? So we're gonna have one pissed off patient down the road. And if I'm trying to avoid that pissed off patient from happening, then we gotta go all on 4. So what you mentioned was a key aspect. Someone's out there is saying, okay, so how are you gonna fix that if the patient's got periodontal disease and they have the bone loss, or they have trauma, they got a lot of buccal bone loss, or the ridge is very thin, or whatever's going on? How are you gonna fix that with an all-on-4? Well, the first option, we could potentially fix it with a lot of guided bone regeneration, a lot of extensive bone grafting, sinus lifting, whatever the heck we need to do. But guess what that is? Way more time, that's way more money, that's more surgeries, which does not sound appealing to anybody.
And the highest level of compliance on the patient's end.
Right. And so the aspect for us to be able to achieve that is with all on 4, we can then place those implants where the bone is. Again, maintaining your 2 millimeters of buccal bone thickness. Not saying you never need a bone graft for an all on 4, sometimes we do, obviously. But to be able to predictably place that implant where I know that implant can last as long as possible to make sure that it's not going to like lose a lot of bone over the next few years, because we know that now you're set up to do your job properly. So All-on-4 can really be used in that sense, right? So that's a key component. And I know that any prospective patients out there that are listening or looking at any of these options, hopefully we can simplify this enough so that they know what's actually going on behind the scenes. Because in the end, again, we just want the patients to have a predictable result, meaning they don't have issues. And again, not saying that All-on-4s or implant bridges or snap-on dentures are always riddled with issues. No, but there can be issues sometimes. And the goal for us is to minimize that as much as possible, right? Now let's talk about one key thing is, I was checking out the website for 3-on-6. One of their attacks on the All-on-4 is gonna be bone reduction, and it's gonna be intaglio surface, underside, so like food debris. Cleansability.
Yeah.
I think that's pretty much it. What are your guys' thoughts in regards to that? And then I have my thoughts. Let's start with bone reduction.
Well, bone reduction, I mean, it's like even if we just don't even do, the material needs a certain amount of thickness, right? Before we can go, whether it's a dental crown or anything like that, we have to trim either teeth or bone to a certain amount of the thickness, just so there's a strength of material.
Right. So it doesn't break, because it's got to have a certain thickness. Yeah. We had that video recently where we drove over it, right, with Dr. Ku's car. Yeah. And it didn't break, right? Because zirconia is strong.
But imagine if we did nothing, right? And now there's two options left for the prosthodontist or for the team that's restoring your mouth. We can make your mouth really full, compromise the aesthetics,
and mess up your jaws,
causing TMJ issues.
Yeah,
correct?
long term. Yep.
Right? Or just giving you something that's not going to work. So to make everything well for the implant and everything in mind, bone reduction is needed for the material.
Right. So what are your thoughts? And then I got.
So I would say, if done properly, the 3-on-6 option can work, but I think there are several conditions that have to be met. For example, case selection is key. Somebody that shows a lot of gum tissue when they smile is probably not the best candidate for this type of work.
100%.
Yeah. And then also you got to go to a provider that does this type of work a lot. You got to have the highest level of expertise, especially to execute this properly. Mm-hmm. So the surgical aspect is very important, but also the prosthetic aspect is very critical too. So you got to go to somebody that potentially can do both very well, or maybe have to be seen by two different specialists, like surgical and prosthetic specialists that do this a lot.
Right.
And then third point is that patient's compliance has to be very, very high. Right. So they got to follow all the instructions very carefully, the instructions from the provider very carefully. But let's be real here, a lot of patients in general do not always follow instructions carefully.
Right. So yeah, you're saying that there's a lot of things that have to go right.
Yeah.
Right.
And then one more thing is that, if you have all the time in the world and if you have all the money in the world, I would say it can work for you. But that's not the reality for most people.
So the stars have to align.
Yes.
Right? Mm-hmm. And so I know there's another guy in Dallas who does a lot of these and preaches them extensively too. And from word on the street is he charges for it. And it's very, very expensive, right? And as we offer too, but and patients are interested in it and they see the price tag and they're like, oh, hell no. Right, and that's what happens a lot of times. But it's what you bring up as an important fact is so you said the surgical component, the prosthetic component, and they have to be done very well by very experienced people. So can that patient out there find that perfect team for that? I remember when I was in Ohio, we were talking about, I was talking to this guy one time, and he was like, if you have a house built for you, then get an Amish person to do it. And I was like, that's an interesting concept. So for here in Texas where we have foundation issues, we need to get that foundation laid perfectly for your home to never have issues. So we're gonna try to build a house that with these crazy rainstorms down here and the winds and tornadoes sometimes, can we build a 100-year house? I think it could be done, but it has to be done very meticulously by people who really, really, really know what they're doing and are well experienced.
Then you have to care about what you do, right? If you don't care, you don't put yourself in the position of the patient, thinking that could be my mom, that could be my dad one day, And it's if you don't care what you do, your work is not going to be able to show it.
That's a key aspect. That's a whole nother conversation, right? I mean, you need to go to a provider that gives a damn about what they do, that takes pride in their work, that can put themselves in that person's shoes, as if again your mother or father. And then also you have to have the proficiency to be able to do it, because you can care all you want, but if you don't have the experience in doing this, what good is it, right? You could have all the best intentions in the world. So there's so many factors that come into play, right? Here's my thought of All-on-4. And this is my grievance is there's a lot of marketing going on behind the scenes. So marketing as to, hey, get your zirconia teeth in 1 week, which is lunacy, right? We'd all agreed on that. Like, and there's no way in hell you're putting zirconia in teeth. And if I ever needed All-on-4, there's no way in hell you're doing zirconia in my mouth in 1 week. With the bone and tissue remodeling, with the weight of material, you couldn't find a worse thing to do to a patient. Another key marketing point that I've seen is that people will try to talk up implant bridges versus All-on-4 by saying, look at All-on-4, they got to do bone reduction. Now, let's be very honest about this topic. We've seen some bone reductions that are scary. The surgeon is literally just wiping out like a ton of bone. Even some things that like wouldn't, like you would see in a horror movie where they basically like saw off like all the bone where the roots come out with it.
Some people do that to just look cool on Instagram.
Right. I mean, it's like, I'd say it's that and zygos that are always like the things that people want to post on Instagram. And it's funny because as many arches as we do, we really try to limit like the number of zygos, that last ditch option that you try to use for a patient. And that's again a topic for another video. Bone reduction. I've gotten way more conservative with bone reduction. Things that I analyze obviously are going to be smile line, number one. Yeah, basically smile line, right?
Patient's age, right? So
Right.
If they're too young, you don't want to be hacking off. Or
Oh
taking
God,
off way too much
yeah,
time.
and that's another thing too. Like that's a very key point. Like patient's age is a huge thing. I mean, if you are trying to like hack off a lot of bone, and then if God forbid, if you place like 4 implants or 6 implants up top or whatever, and you lose an implant, do I have enough bone to place another implant? That case that we had from Virginia, again, she's 37 years old. I just started packing bio-os everywhere, because bovine bone is low substitution. That bone's really going to be there still, even if you go revisit like 3, 5, 7 years later. Even though I didn't place implants in her sinuses, I did trans-sinus, but I did sinus lifts on her. I'm not a pessimist about things, but I'm always trying to kind of act in a way that, okay, God forbid, she's 37 years old. If she was to lose an implant, do I have an option here? Well, I lifted both sides, and I did a huge sinus lift on the left side. And then also one day, and then we could use that. And God forbid that goes wrong, then we could do zygos one day, right? Having contingencies for contingencies is always like a key aspect when we're doing surgeries. So again, we can set you guys up for success. But very key important point, if we go around, start reducing all the bone, acting like we never need any contingencies in the future, I think that's just like a very irresponsible thing to do for the interest of the patient. Well, were there any other concepts, guys, I wanted to discuss in regards to whether All-on-4 and snap-on dentures, or maybe implant All-on-4s versus like implant bridges such as 3-on-6? Any parting thoughts?
I would say, having multi-specialty in the office allows you to have the patient to have multiple consults, multiple perspectives on what's best for them, right? If you go to a one place that only does one specialty, they're always going to downside what the other things will be and upsell you on what they can do, because that's the only service that they can provide. So when you have everything, I've seen where Dr. Choi is like, I don't know of an All-on-4 on you, and he sends that patient over to me and see what I can do to restore individual teeth and whether we can prolong these teeth for another 5, 8, 10 years. His hygiene is not great, then we revisit this topic. We're always in the best interest for the patient. I think you've done a great service hiring a good team, allowing the patient to have multiple options, what's best for them, and ultimately let them decide.
Right. Because it's always the patient's decision. So our goal is to educate you as much as possible and let you decide. There's multiple factors that come into play. I mean, dental school had me thinking differently, but once you're actually in private practice, you do see some patients, they do try, and yet their teeth break down faster. So if you see cases like that, then maybe it would be more prudent to look for another option, trying to save them, but you gotta at least present them all their options, right? And then also, I think a key point is educate yourself as much as possible. Depending on what area of the country you live in, watch as much content as you can about all these topics. Just educate yourself. You have to be your best your own advocate. Be aware that you brought up a very key important point. Some providers are going to try to pigeonhole you into a certain option. Some offices are going to turn everything into an implant. Some offices are going to turn everything into a root canal or a retreatment of a root canal. Some offices are going to do full mouth of crowns on you again. Is that going to be the best option for you? So the only thing you can really do, if I'm trying to picture myself in a patient's shoes, is there's a lot of resources out there where you can, again, like YouTube or looking online to learn more about this, and seek multiple perspectives. Try to find somebody that's going to have your best interests at heart.
Yeah, we've discussed various treatment options today. I would say each option can work depending on your situation you're in. I've seen patients that started wearing dentures in their 30s and now they're in their 60s, still doing fine. I've seen snap-on denture wearers that are able to eat their favorite, Texas barbecue, no problem. But I would say, in my opinion, the biggest bang for your buck is probably all-on-4.
Okay.
Yeah, all things considered.
I love that perspective because you brought up a key point. What works terribly for one person might work well for another patient. There's been patients, you're right, like have been in dentures for 20, 30 years and don't have any issues. And then we have their son or daughter here in our office and they're like, I don't know how my mom or dad does this. I can't function. So there's always a different solution for everybody. And there is not a simple cookie cutter formula that's always gonna work. But if we were to make a broader blanket statement in regards to, if I was to guess before I walk in this room, don't look at the patient, don't look at the x-rays about what's gonna work for this patient. 100%, if I gotta put money on it, I'm going with all-on-4.
These are treatments that they replace the full mouth. So these are more complex cases. So in order for the patients to be able to understand what they have and what they're candidates for, I believe that it's the best idea to get around and opinions about these treatments and what they have in their mouths right now, like the anatomy and everything. And if there is a team with a lot of specialists, a lot of dentists that can actually get together and have a personalized treatment for them, that would be the best. So like a private practice that actually can have that group of specialists give a more comprehensive treatment for them and explain everything.
To your point, it's I've had Dr. Ibrahim come into my surgeries and it's like, just make sure you cut enough up here because of that smile line. Just constantly reminding me of patient's best interest at heart and how the better outcome is to have multiple doctors kind of going through that process with them and ensuring that we're doing the best thing we can for them.
Yeah, it's a teamwork.
Right. All right, guys, I appreciate your time in discussing these topics. So we'll do this again with some other topics too.